A couple of hours because NHS consultants in England have voted in favour of strike action in their fight for more pay. It follows a 5-day strike by junior doctors. The combination is likely to lead to significant disruption to services. Well, a BMA spokesperson has been talking about this latest announcement. Let's have a quick listen.
So this has been the accumulation of lots of pay cuts over the last decade, as I say. And because inflation has been rising, it really has exacerbated the losses we've actually had. And it's really brought home just how much pay had fallen prior to this current rise in inflation. And that, coupled with what's happened during COVID, has really brought the focus on how much consultants do, what the working conditions are like. And really, it is getting to the stage where people are now leaving in large numbers. And we need to do something to try and prevent that.
Let's head to the newsroom. Let's head to our health correspondent, Nick Triggle. And Nick, what else have the BMA been saying in terms of the outcome, first of all, of this ballot, the numbers?
Well, they say it should send a very clear message to government about how strongly consultants feel about the pay issue. These are the most senior doctors in the NHS, and their 48-hour strike, which begins on the 20th of July, follows almost immediately on from a 5-day strike by junior doctors, and it means and threatens huge disruption across the health service. We've already seen around 700,000 appointments and treatments cancelled or postponed in England because of the industrial action, and the waiting list each month is going up. So there's real concern about the impact this will have on patients, but the BMA is adamant that they've been left with no choice because of the government's unwillingness to get into talks about restoring that lost pay the BMA was just setting out.
Yes, they talk about restoration of pay going back to 2008-9, but the government in their response talking about the 4.5% pay uplift last year, talking about average earnings of 128,000, talking about those changes to the taxation system in the budget, all helping consultants. I mean, what are the BMA saying in terms of a percentage rise that consultants actually want here?
Well, they have been looking back at how pay has failed to keep pace with inflation since 2008. And if you look at that, there's been a cut, they say, of 27%. This is using the RPI measure of inflation. If you use the more favoured CPI measure, it's less than that. But they also point, as you said there, Matthew, at the tax and pension changes. Now, we've seen tax thresholds, income tax thresholds, frozen for, well over a decade. We've seen the introduction of an additional rate of tax at 45%. And that has meant that consultants, because they are amongst the best paid in society, have actually seen their take-home pay, the pay that ends up in their pocket every month, fall by even more. So going back to 2008, once you take into account those factors, it's fallen by 35%. Now, the British Medical Association aren't saying they want this restored all in one go. In fact, all they say they are asking for is that in the future, pay keeps at least pace with inflation. Last year, they were offered 4.5%. That was less than half the rate of inflation during the past year, and they've yet to receive an offer for this financial year. The government has been busy, obviously, negotiating with junior doctors about their dispute. So the consultants are hoping they will have talks soon, and they say if the government comes forward with some reasonable offer, it's not too late to call off this strike.
Nick, stay there because another development in the health sector through the course of today came from the Royal College of Nursing. They had their ballot for more strike action. It didn't actually reach the threshold in terms of numbers voting, so there won't be any more strike action. And the government, the Health Secretary, Steve Barkley, has been talking. I want to put that on the screen.
We reached a deal with the NHS Staff Council that the majority of trade unions agreed to. I'm pleased that the RCN have now ended their industrial action, and we stand ready to work in partnership with the NHS Staff Council as a whole, but also with the RCN. There are a number of aspects of our deal with the Agenda for Change unions. We continue to work with them, and we stand ready to do so with the RCN.
Well, that's the government position. Let's hear from the RCN because Pat Cullen is the General Secretary for that union and had this to say about the possibility of another ballot. She said it was conceivable later in the year.
What it means is that the campaign will continue. The job is not finished. We're on a journey. I think the government's very clear about what that journey is. It's about addressing nurses' pay. It's about looking at how we reward nurses as we move in the future. Addressing retention, addressing recruitment, and looking at how we can actually attract more students into nursing and making sure that they have the proper bursary to survive whilst they're training and being educated.
Well, that was Pat Cullen. Let's go back to Nick Triggle, who's there in the newsroom. I suppose a glimmer there of good news for the government regarding the nurses and that development today. But in terms of this consultants move and junior doctors, any sort of estimation in terms of the levels of disruption we're likely to see with more cancelled appointments?
Well, if you consider that junior doctors represent nearly half the medical workforce, and we've seen significant disruption, 4-day strikes or over 100,000 operations and treatments cancelled. This next one by junior doctors will be 5 days, so will be even more significant. And of course, consultants are the ones leading teams. They're only saying they will provide Christmas Day cover, which is basically providing cover for emergency services and a very limited amount of routine work. So the disruption will be significant.
Nick, thanks very much. Nick Driggle there in the newsroom for us.